Hello there, welcome back to my channel. Thank you for always coming back to watch my videos. And if you are new to my channel, I'm Tessie by name. You are welcome to my channel. So in today's video, it's more of like a continuation video. Okay, I made a video on urine analysis, and I said that urinalysis has three parts. It has the physical, the chemical, and the microscopic parts of it. Okay, so during the course of urinalysis video, I talked on the physical analysis part of it. Okay, and today I'll be talking on the chemical analysis part of it. So if you have not watched our urine analysis video, kindly do so. It will help you to understand this video better. So if you can see, I have my hand gloves on. It's more of like a practical video, so dive in properly and sit well to watch how urinalysis is being done. Okay, so I have my combination. This is what we'll be using for the urine analysis test. I have two samples here. I have sample 1 and I have sample 2. Then I have my gauze for draining excess urine. You can also use your tissue as well. So if you open this combination, this is how the inside looks like, and it has a lot of strips. Each strip is for each sample. Okay, when you use it for each sample, you discard, you don't use it again. So when you get the urine sample, each sample represents a patient, so you have to handle with care. Okay, you have to mix very well. Then get your combination strip. See how it is looking like. Okay, get used to the color. The first one is red, the other one yellow, the other one blue. Others are more of like plain. So when we dip this combination in this urine, let's see the changes so that we can read the results together. So we are doing for sample 1. Cover the urine and set it aside. And use your gauze to drain excess urine. So this container is what we'll still use to read our results. After dipping the urine, look at the changes. I don't know if you are seeing the reaction already. Let me get the one, let me bring the new one out so that you see how the strip looks like when it has not been dipped. This is the one I've not dipped. Look at the one I've dipped. So you can see the changes. The red one changed to green. The second one did not change. The third one changed to pink. Others did not change, but the one on top changed from yellow to green. So let's read the results together. So it is now time to mash it. So this first one now, this first roll you are seeing here, this first roll, I don't want reflection too. It has lines with arrow. These are the ones that is normal. Like if any color should match the ones in this row, then it is normal. Then for this urine sample 1, you can see that the pH is not the same thing with the first one. So we have to look for where this color matched. Okay, let's keep checking. The second one did not match it. Third one, yeah, it's green, but it's not like the one we have in our strip. You move to the next one. Yeah, so the pH of this urine is 8, which is slightly alkaline. Okay, let's move to the second one. The second one is glucose, and you can see is yellow like the first one in the column. So this person does not have glucose, is negative. Then the third one that is pink is ascorbic acid. You can see it's not the same thing with the one in the roll. It's not the same thing with this one. It matches the third one. So ascorbic acid is vitamin C, like if you should consume vitamin C, maybe pineapple, orange, anything that contains vitamin, it will reflect. So you can see that this person is consuming enough vitamin C. It's showing in this urine sample 1. Then after the ascorbic acid, we move to the next parameter, which is ketone. Ketone, this person's ketone is negative. It's the same thing like the first one, is colorless. Then the next one is nitrite. Nitrite is also colorless, so it matches the first one. The next one is protein. There's no protein. The protein is negative. It's not changed to green, so it's with the first one, which is in line with the normal results. After protein is bilirubin. Bilirubin is normal. There is no bilirubin in this urine. Same thing with urobilinogen. Did not change color. Then the last one, which is the one on top, the normal one should be yellow, but it's not yellow. It turned to not even light green, not even the next one. It matches the third one. Yes, this is blood that we just examined. The last one we did is blood. So this urine contains blood. So when you see blood in urine like this, the first thing that will come to your mind is this person male or female? If it is female, you will ask if the person is menstruating. If the person is not menstruating, then there is need to do further investigation to know where the blood is coming from. Okay, so this is for our sample 1. Then let's analyze sample 2. Remember, you have to mix the urine thoroughly. Okay, get your combined strip. You don't have to touch these surfaces. There is a space for you to hold it. Okay, so when you touch the surfaces, it will affect the results. You have to avoid touching these areas that contains the parameters. Okay, then you mix as usual, and then dip. Please ignore the noise. Okay, it's just one of the challenges we face. Noisy environment, you cannot manage it. Okay, so you guys should bear with us. So this is I'm draining the excess urine from urine sample 2. So you give it sometimes, like within 60 seconds, you should read the result. Okay, any color that develops after 60 seconds is invalid. So this is for urine sample 2. I've dipped it. This is the one that I've not dipped. You can see that it is very dry. So I'm just trying to compare. So let's read this urine sample 2 together. So you can see the pH is the same. So this person's pH is 5. Okay. Normal urine should be slightly acidic. Okay. Then the glucose is yellow. It did not turn to green. If it should change to green, then it means that the urine contains glucose, but it's still yellow, which is the same thing with the first column. The next one is ascorbic acid. This one matches with the first one. Unlike the other one we did, that one changed to pink. So this person did not consume any vitamin C drug or fruits, maybe recently. Okay, then the ketones, they are negative. Nitrite negative. Protein is negative. Then this bilirubin, this person's bilirubin is reacting. That is this yellow that you are seeing here is reacting because it doesn't match the first one, which is supposed to be negative. If you take it down, look at the color it is matching here. You can see it is matching this and this, so it's in between this. It should be this one. Yeah, so there's bilirubin in this person's urine. This person is supposed to run liver function test, okay, to know if this reaction is of significance or not. Okay, so there is no urobilinogen in this sample, and the last one, which is blood, is yellow. It did not turn to green like our first sample. So you can see that urine analysis is a very simple test, but it will tell you if the patient has glucose, nitrites, protein, blood. Like, it's just like a picture of what is happening inside of a patient. So if there's anyone that is significant here, for instance, if the glucose is reactive, or like it changes to any color, even if it is the light green or intense green color, you now advise the patient to go and do fasting blood sugar to confirm this person's sugar level. So when glucose is seen, diabetes mellitus is suspected. When bilirubin is being seen, you suspect jaundice of any type, be it obstructive jaundice, hepatocellular jaundice, any form of jaundice. That is when you will suspect jaundice, okay? If urobilinogen is suspected and is seen in this urine, in the end of the urine samples, then you have to still run further tests to know what is causing the hemolysis, okay? Because when there is hemolysis, urobilinogen will be seen. And in blood, when blood is seen, like I said, if it is from a menstruating female, then there is no cause for alarm. It is normal. But if the lady is not menstruating, you have to check why there is bleeding. And if it is from a male sample, it is no, okay? You have to run a detailed test to know what is causing that blood, if it is as a result of bacterial infection, okay? Or if there is any urinary schistosomiasis, or if there is glomerulonephritis. Even in sickle cell patients, you can also see blood in the urine, okay? Then ketone, when there is ketone bodies, these ketone bodies, when it is being seen, it signifies that there is untreated diabetes mellitus, or the person is suffering from what? Severe starvation. So that is for ketones. When you do your urinalysis and you see that your ketone is 1+ or 2+, it means that the person is suffering from severe starvation, or that there is diabetes mellitus there that has not been managed well. Which other parameter have we not talked on? Protein too. If protein is seen in pregnant women's urine, there is no fear for that, okay? But if the person is not pregnant and there is protein in that urine, okay, it also indicates urinary schistosomiasis, okay? It shows urinary tract infections, nephrotic syndrome, you know. Protein can be seen in the urine of young people too. So I believe we enjoy this chemical examination of urine analysis. So whenever you do your urinalysis, don't see it as is a very cheap test, is something that should not take serious. You have seen that it contains 9 parameters. So whenever you do your urine analysis, take time and go through your results and make sure that most of the parameters there are normal. If there is anyone that is a bit high, step up a bit and go for a comprehensive test to confirm if what is being seen in the urine analysis is true, okay? So thank you so much for this quality time that you have spent with me watching this video to this point, and kindly subscribe to my channel if you have not subscribed, okay? And always on your notification bell so that each time I upload, you always get notification, okay? Thank you so much, and see you in my next video. Bye.